And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Well, hello. Welcome to Keeping It 100, where we have these open and honest conversations to make sure you have all the information you need to make good health decisions. I am your host, Dr. Kristen Ball-Motley. We have a great show in store for you today, as always. Now, Dr. Thomas is on double duty. She is a guest, and she's behind the scenes right now. So she's going to hold it down in the chat. So give us a shout out. Give yourself a shout out in the chat. Let us know you are here. If you have questions, put them in the chat, and we're going to take care of you today. As always, let's bring in my super duper co-host, Georgie Mink Jr.
Hey, good afternoon, everybody. How you doing? What's going on, Doc?
Hey, Georgie. I'm trying to fight this cold. It's trying to hold me down, but I'm trying to fight it the best that I can.
Okay.
I don't know why a virus is always finding me, but all my tests came back negative. I was negative for strep, RSV, flu, COVID. So all the popular things that they could test for is all negative. So I'm just chalking it up to the random viruses that be in these streets.
Yeah, but see, that's why it's good that you protected and that you vaccinated.
Sure.
And just, set up for war, just in case.
Listen, I'm ready. Come for me. I'm ready. My antibodies can't wait.
Right. That's what I'm saying.
We had a really good time at Family Night Out last week. I want to give a shout out to Health Educated, the team that put on an amazing event. Everybody seemed like they had a good time. We had some pictures. From the photo booth, shout out to my sister JB Flicks, to all the vendors. We had healthy snacks. We had to-go platters. BJG Woo was on the ones and twos with the COVID booster PSAs. It was just a really, really, really nice event. Yeah. What you think about it?
Oh, man, I had a wonderful time. Like, I love when we interact with the families and the community. Just everything about health and just, health and wellness, just health and wellness, just everything, Doc. It was a good day. I had a good day. I had fun. And me and Jen took some pics on the photo booth. I didn't ice skate, though. So maybe at our second annual, you might pull me out, might pull the skates out. But
I had heard that the last time you was on ice skates, you had failed.
Oh, yeah, I had a good time. I might find some footage and prove it to you. But, yeah. Shout out to Corey, though. I saw Corey out there on the skates.
Corey Law was ice skating.
Making a change in the building. Yeah, they was out there. Yeah, it was a nice event. Yeah, I just seen it real fast. It's okay.
I really want to give a shout out to Brittany Hales, Lauren Footman, and the entire county council for making the event possible. We didn't have to pay for the space. We didn't have to pay for skates or anything. They just let us come and do our thing. So thank you to everybody who helped me put on the event.
Mm-hmm.
So it's February. It's American Heart Month. It's Black History Month. Last week, I didn't realize it was February 1st until right before the show. So I wasn't ready with like a Black History fact. I ain't had no heart facts. I had to come up with something off the dome. I wasn't prepared. It was given unprepared for sure. But today is a new day. We back. They're not gonna catch us slipping no more. So let's get right into this Black History segment with Georgie.
Hey, yeah, my guy, Dr. Charles Drew. I think he's a pioneer in his own right, especially at the time when he created and discovered, the blood plasma. But I'm just going to go into a little details, a little summary segment that I wrote up. And I'm going to just put, I'm going to just say, basically during World War II, Dr. Charles Drew developed a way to getting life-saving blood plasma to service members injured in battle. Known as today as the father of blood banking, Drew was a key pioneer in developing ways to store and transport blood. His methods were adopted by the American Red Cross. In 1950, at age 45, Drew suffered serious injuries from a car crash in North Carolina. Surgeons at a nearby hospital were unable to save him. So he was survived by his daughter Charlene, Jarvis, and I think there was the only two children. Charlene now is 80 years old, and his son Ernest is 59. He just was a pioneer. I mean, they called him. I forgot the nickname that they called him. I had took some notes, but he basically is the reason for us to be able to get blood transfusion today, which is major to me. What you think, Doc?
Yeah, I mean, I think what he's done is incredible. And I didn't realize he passed away at 45, which means that he was a young genius getting
Mm-hmm.
it done, which is really, really incredible, really, really impressive. And one other thing that I was reading about him was that during World War II, when he was trying to encourage the army to use blood, they didn't allow black people to donate blood. But he was
Mm,
like, look, there's no difference. There's no reason that you should restrict who the blood is coming from. Y'all need the blood. Your soldiers are dying. So in honor of Black resistance, which is the theme for this month, for this year's Black History Month, I want to give another shout out to him because he fought hard to allow the military to use blood from all donors, and they
mm,
eventually accepted blood from all donors, and so that was a big move for him. And he was so young. He was
mm-hmm,
so young to have that fight in him. So thank you, Dr. Drew. Thank you, thank
mm-hmm,
you, thank you.
mm-hmm,
Thanks,
mm-hmm.
G, for your Black History Month
Hey,
moment.
yeah, that's gonna be me all month, Doc. I have some good stuff for you next week.
Awesome, awesome. Um, I've been fighting this cold, so I really haven't been keeping up on a lot of health news. I just want to remind everybody that COVID is still out here. Now, I was looking at the numbers last night, actually, and in the US, numbers are going down with cases and deaths and hospitalizations. So that's good. Hopefully, we can, start to move in this direction where it's like an annual thing that may happen in the fall, happen in the winter, but we really got to be safe, make sure we get our boosters every year, and just keep ourselves protected. And then it's a non thing. So I can go out into the world and not have to have a mask on every time I leave my house. So I'm really looking forward to getting closer and closer and closer back to normal, and just understanding COVID isn't going anywhere. It's just a new thing we got to protect ourselves from.
Yeah.
Um, so the other thing I wanted to mention, oh, we also went to we did a health fair at Murphy AME Church in Chester on Sunday. I
Oh
forgot
yeah,
to
yeah,
mention.
yeah. How could we forget that? Oh
I
yeah.
know, and that was a really, really good event. They had it right after church service. And one of the things that really meant the world to me, I've been looking for people that haven't gotten their first dose to come through to one of our clinics because we've been doing a lot of boosters, but I haven't seen any first doses. But yeah, two first dose patients at this particular clinic, and they were children. A
Mm,
mom brought her 5-year old and her 7-year old to come in and get their first dose of the COVID vaccine. I think we have some pictures of that. And that just really, really warmed my heart. So shout out to mom for protecting her kids. It's not too late. You can still get your kids vaccinated against COVID so that they have some protection. I don't know what the numbers are now, but I know that the last time I looked, this was months ago, 900 children in the US died from COVID. So we don't have to have our children be a part of that number when there's a vaccine that can prevent that from happening. So let's do what we can to protect our children.
mm-hmm, mm-hmm.
I think we have a little video of you talking to one of the the congregants
Oh
there.
yeah, yeah, yeah. Yeah,
The
that was me and my mom over there.
She was giving out free COVID tests. That actually was my friend Crystal's grandma, and we call her Mima. So I'll always see her out, and I love seeing her out in the community. But you always doing your thing.
Mm. Bless you, bless you, bless you.
Thank you.
Okay. We good, Doc?
One more sneeze.
Okay. Okay. Yeah, take a little sip
My
and,
mom told me stop.
and come back in.
Mom told me stop doing this show when I'm sick.
Yeah.
But it's Black History Month and it's Heart Month and it's too much to talk about. We can't just let it go. I
Okay.
want to bring in our guest. Let me give her a nice introduction. Hold on, let me just sneeze first.
Mm.
All right, Dr. Tyan Thomas. Now she is not a stranger to the show. She's here every single week, week after week, but she's usually behind the scenes. Today, I asked her to come on because she works with patients who have heart disease and she does smoking cessation counseling for these patients. She graduated from the University of Maryland School of Pharmacy. They completed 2 years of residency training so that she could specialize in working with people who have diabetes and heart disease. Sorry. For the past 17 years, almost 20 years, she's been on the faculty at the Philadelphia College of Pharmacy as a clinical pharmacist, and she also works there at the Philadelphia VA Medical Center. Throughout her time as a clinical pharmacist, she's counseled patients who wish to quit smoking. She's also written book chapters on smoking cessation for nurse practitioner students. She knows what she's talking about. She's a leader in this field. Welcome to the show,
Mm.
Dr. Taria Thomas.
Hello, hello.
Wow. Dr. TT, what's going on?
Hi, everybody.
Thanks for
Glad to
being
be
like
on.
an official guest. I typically bring you on like at the last minute when I need somebody, or but you are the official health educator, keeping it 100 guest today. So thank you for playing this role as well.
And thanks for having me.
Of course. So today's topic, we're talking about smoking cessation and quitting smoking. We're just still toward the beginning of the new year, and I'm sure a number of people made a New Year resolution to quit smoking. And so we wanted to talk about, provide people with some tips and some tools on quitting smoking. But before we get into that, I wanted to ask, how long does it take for a person to become addicted to smoking?
That's a good question. So it can take just a few times of doing something for it to become a habit, right? And then the addiction can start right away. So you get a rewarding sensation when you smoke, and it's from the nicotine. And so after like the first two or three times, your brain can get used to that feeling. And then after, three or four times or so, then you can also get used to that habit of reaching for the cigarette when you feel stressed, or if it's social and you're used to, hanging out with friends and then smoking with them because they're smoking. And so, I mean, it really can occur, really quickly. And then especially in kids, right? So a lot of the data shows that people pick up the habit as like teens or like early 20s, and those habits can take hold even more quickly in young, in adolescents and young adults. So
It's really interesting that you say that because I haven't looked at the studies, but I used to teach quit smoking classes, and I think the youngest age that one of the participants reported they started smoking at like 9 or 10 years old because their older cousin was smoking, and he said, "Hey, try this," and they tried it, and then I think the woman was like 60 or 70 something years old, and she was like still smoking and trying to quit. And
Mm.
so, it's interesting to hear that the studies show the earlier this you start, the more easier you can become addicted. And I guess that's because your brain is still developing. And so, wow,
yep,
wow. And
exactly.
so this is a pivotal time for us to train young people about um, substance abuse prevention
Yep.
because of that. So thanks for sharing that. Now, how long does it take for a smoker to see the effects of smoking cigarettes? Is
Um,
does that happen like right away? Does it take years?
So I guess the rewarding effects, it could be like within minutes, 5, 10 minutes of like the first puff, they'll start to feel like relaxed and more at ease, and just that rewarding sensation that you get. And it triggers, the sensation or the part of the brain that kind of feeds reward. And then even some of the other effects of like speeding up the heart rate, blood pressure, like that can occur within minutes. The habit part, I don't know the data as much, like the whole habit of like, okay, I'm feeling stressed. Let me go grab this cigarette as like a way to calm myself down. I mean, that takes a few times of doing it. It can be as soon as like 4, 5, 6 times, or for some people, it can take a little bit longer, right? Like it depends on like their coping mechanisms and things like that. But like the physical addiction part of it can occur like after like 3 or 4 times, quite honestly.
Wow.
So
Mm-hmm.
it kind of sounds like you don't have to smoke for years for it to become a problem. Like
Oh,
when you're
absolutely.
holding a cigarette and you're smoking it, your heart is already impacted right then and there. It's not like a long term thing. So I guess over time, all the long term things get worse or you have a higher chance. But it's like it's a problem immediately.
Yep,
It's a problem.
absolutely. Absolutely. And then, as you said, like when we're younger, our bodies can like rebound a little bit more quickly. But then once you get years into it, other things already start to affect our heart. And then when you have the cigarette smoking on top of it, it's like 1 + 1 = 5 instead of equaling two. It's like just compounds, and the unhealthy effects on your heart and all parts of your body, your circulation and everything. Yep.
G, did you have a question about
Well, I had two questions. One,
secondhand smoke?
is it like
Yeah,
for
go ahead.
some of the I guess the facts that you just gave us, is it a difference between men and women?
No, it's pretty universal, across the board. So it's something that's going on like in our body and in this at the cellular level, like with that actual nicotine. And then as we're talking about smoking, I also want to say too that it's just not only nicotine that we're inhaling, it's all of like the tar and the other
All
stuff
right.
that like and so heavy metals and things, and so those also have effects, but it's equally damaging to men and women. Yep.
Wow. And how bad is secondhand smoke?
So secondhand smoke, it's been shown to increase the chance of asthma and lung problems and people who are, in close proximity to it. And so it's just as bad. I mean, of course, it's not going to be as strong of an effect as the person
Mhm.
who's like directly smoking it into their bodies. But yes, and especially if you think about the fact that often it's kids that are in the presence of their, adults, so they don't have the option to let me leave and come back later or whatever the case is. Their bodies are so small. So even like small amounts of like nicotine and exposure can have like a larger effect compared to like
Mm.
an adult who's fully grown. So,
Right,
yep.
right, right.
Are,
Okay. Go
are
ahead.
there any strategies that you recommend to parents who are smokers who have children to limit their exposure?
Yeah. So like going outside, to smoke, and trying to leave like, because the smoke can get into your clothes as well. So trying to like whatever jacket you have on, keep it outside, or somewhere where it's not like in the immediate vicinity. So those things can help. And I mean those are probably the biggest things. Just trying to smoke outside. And I mean, that's pretty much it. And of course, the best thing is to try to quit. But like if you're in that process of quitting and
Yeah.
trying to cut down, just like trying not to do it in the house is the biggest thing you can do. Yep.
Okay.
That's a good point. One other thing. So I remember in teaching smoking cessation, one of the things that I would talk to the participants about was there's a physical addiction component, and then there's the mental component of it, where you're just trying to deal with stress and you smoke as a response to dealing with stressors and triggers. And then there's the psychologic component to it where you're just like repeating behaviors. And so I wanted to just start by asking, so for people that are,
I,
are smoking.
I can't hear you, Dr. Motley. I'm sorry.
Oh no, can you hear me, G?
Yeah, I can hear you.
Oh, you can hear me. Let me
Let's
see.
see. Uh, hmm.
We'll give her a second.
Oh, I can hear you now. I think it was
Okay.
my on my.
Okay, okay.
Okay. So when people are getting in their car and they just used to lighting a cigarette, or they have a drink and they light one up. What do you recommend for people to break that psychological repetitive behavior component that's associated with smoking cigarettes?
Okay. That's a good question. I think it's one of those things that, the person has to really think about, like, kind of go through their day and try to reflect on, like, what are the triggers that are like saying, like, this is my time to smoke. So like you said, if they know, like, their habit is when I get to the car, that's the first thing I do, trying to do something to kind of disrupt that cycle. And that's been a theme, interestingly, that I've heard some of your other guests say when we're talking about stress and coping mechanisms and things like that. But it applies here as well. So, like, if like, when I get to the car, I know I'm used to wanting to take that smoke because I haven't smoked since lunch or whatever the case might be, trying to do something different in that walk to the car, right? Like maybe chewing gum instead, or something that can kind of help occupy, like, what you would when you would be smoking, like, a toothpick or something like that. So just one small thing that can break that cycle. And for everyone, it'll be different, right? So, like, they have to know themselves too, to know, like, maybe if they're like eating like a carrot stick or something, then they're not going to want to smoke right after eating, like something that disrupts the cycle and can, like, get them to redo their habits and with their routine, I think, is the big thing.
I think that's a really good point. So just coming up with a plan to break that routine that you're in, to distract you
Yep.
so that you're not
Yep.
even thinking about it, and like you're kind of out of routine, really.
Yep. Yep.
Now, like, what about the physical addiction to nicotine? What do you recommend to help patients with that?
So what we have on the market, and most of the products are over the counter, are nicotine replacement therapies, right? So we think about the gum, we think about the patches. Those are the ones that are over the counter. There are other forms too. There's like an inhaler that requires a prescription. But what happens is those products kind of give your body nicotine, right? So you get a little bit of that nicotine, enough to kind of quiet down that, like, physical dependence that is satisfied when you're smoking, but you don't get all of, like, the heavy metals and the tar and the other bad stuff that you get from the cigarette smoking. So that really helps with the physical addiction part of it. But there are also medications as well that can help with that more of that psychological dependence, and also can help with the physical dependence. So there are medications called bupropion, which is Zyban was the brand name, like, way back a long time ago. And that kind of helps with, like, that reward sensation that you get from smoking. It kind of, like, brings that down a notch. So that kind of helps more with, like, the psychological part of it. And then there's also something called Chantix, and that actually helps with both, like, that reward that you get from it, and it can also help with that physical dependence. And so there's some other drugs, but those are, require a prescription. They have side effects, and so you have to go and talk to a provider, like a physician, a nurse practitioner, because they have to make sure that it's safe for you to be on those medications. But the data currently shows a combination of those products, so nicotine replacement in combination with, like, bupropion or Chantix, they tend to work well together, because you're kind of battling both parts of it, the psychological part of it and the physical addiction part of it. But you also have to do a third component, is the behavioral part, right? So it's like, if you're around people who are smoking and you're still in those, like, triggering situations, and then you're, like, doing your nicotine patch, like, you're just setting yourself up for relapse. It's just like all three of those components need to go hand in hand.
Yeah, they absolutely do. And I know people that have tried to use the nicotine replacement, like the sprays and the Nicorette gums, and they say that they don't work for them. I think a part of the challenge is that people aren't using them right because they don't know how to use them. So I recommend patients, talk to your pharmacist before you leave the pharmacy and make sure you understand how to use it, because there's a technique to chewing the gum, and that you take the right amount that correlates with how much you smoke. So they are over the counter. They're trusting people to use them right, but people don't use them right.
Yep.
Do you have any experience with that, Dr. Thomas?
So the one thing I think about with the gum is that it's not just like chewing gum, like you chew Trident or whatever it is. Like you have to kind of bite it and park it on your like in your cheek, and so it's
Mm,
not like it's not natural. Like usually we want to chew it and chew how we chew normal gum. So I think that's the one thing I would say. Just make sure that you bite it and just park it, and because you have like you have what am I trying to say? You have blood vessels there that line your
Yeah.
mouth, and that's where the nicotine gets absorbed and goes through your body. So it's better to just like chew it, like bite it and park it. And so that's one of the things that I would suggest. The other thing I would say too is, if you do have time to talk to the pharmacist, don't be alarmed if they ask you questions, because usually those questions are to make sure that you're getting the right dose, right? So with the gum, the number of pieces of gum that you take or the dose that you take depends on your time to the first cigarette, right? And so, I can imagine now my mom smokes, and I can see her saying, "Why are they asking me all these questions about what time, how long after I wake up does it take for me to smoke?" I can see that coming on, and so they will ask those questions because they want to make sure you're getting the right dose, right? And so if you take that first cigarette within 30 minutes, that tends to suggest that you're more highly addicted than the person that can go a little bit longer without that first cigarette. So that person needs a higher dose of the gum. You see what I mean?
right.
For the patch, we base the dose on the number of cigarettes smoked per day. So if you're smoking 10 or more cigarettes, then you're going to get a different dose than if you're smoking less than 10. So I would just say be open to, knowing that the pharmacist may ask questions, but that's just so that they can make sure you're getting the dose that's right for you. So
Wow. So do you think that the Surgeon General is doing a good job of just keeping us aware of all the things that can go wrong, like and how deadly smoking is?
I think so. I think it's one of those things that is just kind of stays in the background now, because I mean, this has been going on like 50 plus years. I remember, I think there was like this landmark report that came out from the Surgeon General in the 60s. And so, like, every year they've been publishing. So I think it's one of those things that they're always putting it out. I don't know that there's been a lot of effort to, like, put it in the forefront. I think COVID kind of knocked that out a little bit. And
Right.
we know how we are. Like, we can only handle a certain amount of information before,
Right.
like, so, and I understand it's rightfully so. Like, they're trying to make sure that public health emergency of COVID, like, everyone's keeping that on their radar. I will say I've been seeing some commercials where they're reminding people that if you smoke, you're high risk for the effects of COVID. So I think they've been doing a good job of making that connection. But I don't know that people are remembering, oh yeah, like, y'all, smoking does so much other bad things too. It just hasn't been, like, highlighted in a while. So, but yeah, I think, I mean, overall, I mean, the government wants people to stop smoking because smoking is expensive, right?
Right.
And you know what? Let me add, because I know that we're going to run short on time. So the other thing that's been kind of new data in this area is that data is showing that the sooner you stop smoking, even if you smoke for years, you can gain years back on life expectancy, right? So there was like a big study out where they were following people throughout their lives of non-smokers versus smokers. And of course, we already know that the data shows that smokers have, I think it's like 9 or 10 years lower life expectancy compared to people of similar like age and medical conditions who do not smoke. And sometimes when I talk to patients, they kind of take the view of, well, I've been doing it for so long. Like, what's the point now? Why stop now? Like, I'm already 30, 40 years in. So I do respond and tell them, hey, the data shows, like, if you stop now, like, if you're 50, you can stop and still can gain some of those years of life that you are hearing that you don't have because you smoke. So I just want to put that out there to everybody to say, like, if you feel like you're ready, like, don't put into consideration, like, oh, I've been doing it for so long, so what's the point? Like, you really can, you know, reverse some of those negative effects of that smoking has had on your body over the course of time. So when you're ready for it, just, do it and don't talk yourself out of it.
That's a really good point. I'm glad you shared that. I'm telling you, I had a 70-year-old woman in my class who started smoking when she was 9 or 10, and she was just ready to quit. Was done with it. Was done spending the money. Was done with the heart problems and the cancer and all that. She was just over it. So it's never too late. It is never too late. I know you have to go to class. Um, so I did want to ask another question about stress really quick because I know that stress is a trigger. Um, what do you suggest that people can do to manage like a stressful situation where they typically will pull out a cigarette and smoke? Is there techniques that they can use to get to that?
Yeah, and I'm coming back to what one of your guests has said before about like kind of recognizing the trigger and like breaking that escalation that can come like
Yeah,
after the trigger. And so, taking time even before you're going to quit and say, let me just think about what is it that I'm doing or that right before I smoke or whatever the case is. So already knowing your triggers. And so that's why I was saying, like, if you know, like there's like a certain situation where you might be high stress, maybe don't even bring the cigarettes, right? Like if you say, I'm one of those people, my willpower is not that great. So it's like, I know if I can't do this thing, I'm just not going to buy it or bring it in the house. So even taking some steps like that, like, don't even bring them, the cigarettes if you can. Things that you can do, based on what you can do in that environment. Like if you are able to get up and walk around, like something that's taking your mind off of like that stress elevation that you're experiencing. Like even like stress balls or whatever the case is. Again, when we think about like smoking, sometimes it's that hand to mouth kind of, ritual that is relaxing the people. So thinking about something where, you can do like chew a toothpick, or of course it has to be something that's in the situation where it's socially acceptable. You might not be able to go and chew a toothpick if you're like somewhere, in a formal setting or whatever the case would be. But like really planning, like you said, Dr. Motley, like just thinking ahead and just trying to say, okay, well, what are my triggers? Even if you're with someone, say like if you hear me say this word, that means like I'm getting a little stressed. I might need to walk away or
yeah,
whatever the case might be. So, like I
that's
said, like a
great.
yeah, yep,
That's really good. And I heard you say the word plan. So having a plan, and that goes back to what Dr. Wall said, what she said about how to stick with the New Year's resolutions. You have to have a plan. If you don't have a plan, it's just going to fail. And
yep.
so I'm glad that you pointed that out because it's so, so important. Well, thank you for joining us today, Dr. Thomas. I know you have class at 1 o'clock, so I'm glad you were able to squeeze us in.
Well,
Um,
thank you so
so
much for this, talking about this important topic, and for just like, sharing these different tips during Heart Month. Like I said, it's never too late to stop. I think that's the like big message that I would like to get out there to everybody. And you don't have to do it alone, right? Like get your friend, your friends, your village, your tribe with you to do it, and talk to your doctor or whoever it is, the people you trust, and they can help you through it.
yes, it takes a village.
Yep,
It takes a
absolutely.
village. Well, thank you again.
Thank you
Thanks,
guys. Good to
Matt.
see you. I'll see you
All right,
guys next week.
have a
See
Bye
good
you
one.
now.
next week. The only other thing I wanted to add to this conversation, I know that people ask about using e-cigarettes and vaping, and what I want to say about that is that they are not recommended as a good way to help you quit smoking because they still have nicotine in them. And so you need to break the addiction altogether, and the nicotine is no good because it's addictive. And so we want to break the addiction. And so they're not good replacements for cigarettes, and they're not recommended for smoking cessation therapy. Now if you do want help, there is free help to help you quit smoking. All states have programs, so wherever you live you can call 1-800 quit now to speak to a counselor. They're usually 24 hours a day, all week long. You can speak to a counselor to get help, to get information, to get free patches. Sometimes like they have free things that they can ship you to help you on your quit smoking journey. So take advantage of these free resources. The tobacco industry had to pay for all the lies they told us for years and years about the
Mhm.
fact that nicotine is not addictive, that smoking cigarettes are not hurtful. They paid out billions of dollars. And so that's what goes to support this free quit line and all these support that's available to help people that want to quit smoking. So again, that number is 1-800 quit now. Now February is Heart Health Month, like we know, so we wanted to do this topic, but I also wanted to mention, piggyback on what Dr. Thomas said about people who are smoking, people who have heart disease having a higher risk of certain COVID complications. And one of those is long COVID. So remember, long COVID is when you have a COVID infection, the infection clears, but you still have these annoying symptoms that just linger on. They can linger for weeks, months, or years. Some people feel chest pain or fast heartbeat. Other people have lung problems. They have trouble sleeping, joint pain, headaches. It's a lot. So I want to remind you all the best way to protect yourself from long COVID. You already know what I'm going to say is to get the COVID vaccine. It is one of the best ways to protect yourself. So we know this information. We've been studying it as time has gone. So as new information comes out, I'll keep you posted. But I wanted to remind you of that. Anything else you want to add, Georgie?
No, I mean, very informative. Good way to start our week. As far as just getting the information out there. Smoking is a big one. We know a lot of people that smoke. It's a big money making industry, but it's also like one of the number one disease killers as well. So, yeah,
Absolutely, absolutely. They coming for our kids, and we're gonna protect our kids. We're gonna educate our kids.
you're right,
They can know better and they can do better, like my pastor always says.
right, right, right.
Well, we look forward to your Black History moment
Yeah, I'm gonna have one up next week. I'm gonna be ready.
next next Wednesday, 12:15. Tune in. Check us out right here on cmpradio.net. Everybody have a great day.
All right, have a good one, Doc.
You too. I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.